Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. One common condition we treat in our office is TMJ pain. So the temporomandibular joint, which you feel right in front of your ear, when you open and close, sometimes that can cause pain. It can also cause like a popping and clicking, or also you maybe not be able to open your jaw as much when you're eating, or you may notice your jaw kind of deviates to one side when you open it. What we're seeing in the office now is a lot of patients are coming in with a lot of TMJ pain because everyone's very stressed out, everyone's working on computers for long periods of time. So I'm going to show you how we treat TMJ in our office. One common cause of TMJ pain is the masseter muscle, which runs from the top portion down to the lower portion of the jaw. This muscle will get very tight, and that can add a lot of pressure and tension onto the temporomandibular joint. So one of the techniques we use in our office to release that tension is a technique called dry needling. So what we're going to do is we're going to place a couple tiny little acupuncture needles into that muscle, and what that's going to do is kind of cause the muscle to relax and take the pressure off of the joint. So I'm going to demonstrate what that's going to look like. So what we're going to do is we're going to feel the muscle. The muscle runs from the lower portion of the jaw up to the upper portion, and it runs right through here. And it's a very powerful muscle and often a source of a lot of TMJ pain. So what we're going to do is we're going to feel the muscle. There it is. And so what we're going to do, that's one spot. I'm going to check out another spot into the And that's how you would dry needle the masseter muscle to relax the muscle and to release some of the tension on the TMJ. Another way we're going to treat the TMJ is we're going to release some of the masseter muscle, but this time instead of using dry needling, we're going to use our hands to do some active release technique on the masseter muscle. So again, with this technique, we're going to put the muscle through a range of motion as we're stretching it. So in this case, what we're going to have the patient do is we're going to contact that muscle and want her to slowly open her jaw so she feels comfortable. Good. And then close. And let's do that again. Good. And close. And again. And again, we want to work all the way from the lower part of the jaw up to the upper portion. The other muscle that we can work on is underneath here. So what we're going to have the patient do is she's going to kind of push her jaw towards the ceiling and just the lower portion. So let's have you extend that jaw. Good. We're going to stretch right underneath and relax and go again. Good. And one more. Good. Finally, the third muscle we're going to treat is the temporalis, which is up here. A lot of people don't think of this as being an important muscle for the TMJ, but a lot of times if you palpate it, it'll be very sore and tender. So what I'm going to have you do is just slowly open your jaw again. Good. And relax, and open, and relax, and again, one more. Good, and you relax. The third way we're going to treat TMJ is by doing a chiropractic adjustment to the joints in the neck. So a lot of times what will happen are these muscles and joints up here will get really tight from a lot of the clenching of the jaw, and so what we want to do is we want to do some chiropractic adjustments to release some of that tension. So what we're going to do is we're going to position her head a little rotated my way. Good. And we're going to release that tension like that. And again, depending on the patient, we may or may not do that. It depends on how the joints are moving up there, but a lot of the time there is that association with the neck tightness, and so we'll often treat that as well. So that is how we treat TMJ pain in our office. If you have any questions, reach out to us at 703-912-7822, or you can schedule online at novachirowellness.com.